matter.
You're watching Real Health and we're talking about back pain and postural correction. So according to Dr. John Sano, TMS or tension myositis syndrome is the major cause of pain in the back, the neck, the shoulders, the buttocks, and even the limbs. And it's caused not by structural abnormalities, but by the mind's effort to repress emotions. I know Angela agrees with this, Justine agrees with this. Do you agree with it, Bailey?
Yeah, absolutely, 100%. I do believe that those sort of emotional things can manifest themselves as physiological problems.
I tell you, when I'm not feeling confident or I'm feeling down, this is my posture. And if that is a continual state, then I'm sure my posture will stay that way for days, weeks, months, you know.
Lifetime.
Yeah, lifetime.
Well, yeah, as soon as you start doing this, you're losing the postural integrity that would allow you to sit up straight.
Yeah.
So do that for long enough and you actually will be incapable of being
Becomes
upright.
the new norm.
Yeah, because you reduce your blood supply to different muscles and then they don't function properly and they become fatigued. So it definitely
actually
creates
can't.
problems. Yeah.
So when we have pain, often it's an indicator of deeper underlying emotional issues as well. What type of issues?
It could be literally anything.
Yeah.
Most commonly, it's lack of forgiveness, old stuff that you're holding on to, anger, old stuff that you're holding on to, past trauma, old stuff that you're holding on to. So trauma is quite common, physical and emotional trauma, but and it doesn't have to be big. It could be the littlest thing, but you've taken it on, the way that you've processed that has become traumatic for you. And often the reason that it manifests as physical pain is because in that moment, we don't have the capacity to deal with it. So if in the moment of experiencing either the physical trauma or the emotional trauma or the car accident or the rape or the nastiness of our parents or whatever the case may be, we were able to process that information right then and there, we'd be absolutely fine.
Yeah.
But because we don't have the capacity to process it, our body says, look, the most important thing right now is survival. I survive the situation the best way that I can. So I go into fight or flight. I deal with only fight or flight. I don't give energy to processing anything else. So sitting in fight or flight, I may or may not reset from fight or flight. And if I don't reset from fight or flight, then what happens is my nervous system thinks that I'm in fight or flight continuously forevermore. So I function almost as though I'm a weaker creature. And so I'm more alert for danger, more prepped for survival, and then I go into more fight or flight more quickly. And so we develop this layer upon layer upon layer of stressing and the layer upon layer of reactivity to stress. But that aside, we can't then in that moment deal with the emotional impact. We can't deal with the energetic impact of whatever the trauma created for us. So we just tuck that little sucker down under the liver, or we tuck it over here in our lower back, or we stick it under the knee, or whatever the case may be.
Later.
I'll deal with this later, but later never comes.
That's so true.
Right? So we're not doing something that allows us to then release it. And the strangest things could release it. You know, if you just screamed at the top of your lungs for a moment, you could release a whole bunch of trauma that you've been holding on to. But we do have more sophisticated methods than that.
Unleash you in a crazy, right?
We have much more sophisticated methods than that. But, you know, we need to find a way of releasing that stuff. Otherwise, it sits in the body. And what sits in the body, your body has to find a way eventually of removing it.
Yeah.
And pain is just a message. We think about pain as an injury. We think about pain as an actual thing. Pain is not an actual thing. Pain is just a messenger. It's just
in fact,
saying something wrong.
As you say that, I remember reading a write-up on Sano's book, and you were saying that a realization must sink in. It's not the mere intellectual appreciation of the process that is enough. The trick doesn't work if that doesn't sink in, that this pain is not actually real. That you can let it go. Your body, your muscles, your bones, whatever it is, they can let this pain go. And that when that realization sinks in, then you'll find that pain is alleviated. But it's not just the intellectualization of it, like, okay, yeah, that makes sense.
I had a very profound experience doing a Vipassana meditation where it was on the 4th day. It's a 10-day silent meditation retreat, and you sit for hours, 11 hours a day meditating. But at one period of time, you sit
Eat, pray, love, right?
You're supposed to sit completely still for the 1 hour, like the one specific hour. The rest of the time, you know, if you can go to the toilet and you can do things. But I had this crazy intense pain in my knee, and it was from an old cartilage injury. And my mind at one point was convinced that my knee was going to physically explode. And I had to sit with it and just breathe, and it was a process. And suddenly, I could feel my whole energy field shifted back into alignment, and it just went, and the pain just dissolved.
What?
just disappeared.
Amazing.
And that
Did you
was,
do this locally?
Yes, they actually run them in Worcester in Cape Town.
Oh, wow.
And that's when I actually really, for my clients as well, because sometimes during sessions pain comes up, but it's old cell tissue memory that's trying to come up in order to release. So it's old trauma that's trying to now release, whether it's physical or. So then I can actually now, from my own experience, I can say, just breathe through it, and then they realize, and suddenly it'll also disappear, or suddenly it'll just reduce and then dissolve. And so it's actually been a very powerful experience for me to recognize how much the pain it can be so consuming, but it's not actually necessarily real.
Yeah, and again, we're coming back to the functionality of the body, right? If you're anxious and stressed out, and this is the thing, a lot of people say, yeah, but how do you avoid stress in this day and age?
Oh, I don't think you can. I think it's about how you deal with that stress.
Yeah.
That's the difference.
Yeah.
Everyone responds differently to it, so you've just got to try and find your coping mechanisms, be it having these types of treatments, finding some sort of outlet, moving the body, whatever the case may be.
I love working with bios, and especially when bios and physios work together, because I feel like a bio says to me, okay, now you're ready for everyday life. What type of advice are you giving to your patients, not just from a physical perspective, but now from an emotional perspective as well?
We sit and chat about what their goals are, and we try and tailor sort of the advice that we give to them dependent on what they're looking for. So we'd love to just give everyone a blanket,
but it doesn't work that way.
Unfortunately,
I find that some people they'll always have pain. They'll always have some issue in their lives because that's their crutch. That's the thing that they hold on to. It's a case of, I'm aging. It's a case of I'm getting older, or my mother had a knee issue, my dad had a knee issue. I'm definitely going to have a knee issue. Do you find that when people just change that mindset, there's room for progress?
Completely.
Yeah.
I mean, I don't know if you'll agree as well, but I believe a lot of it is an unconscious processing. A lot of it is being in that victim state or wanting attention for some reason from the injury, or. But you've got to kind of recognize and come back into alignment with your own body's inherent ability to heal itself.
Yes, yeah.
And
Also,
that to me is when the healing happens on all levels: emotional, mental, physical. Psychologically, it all starts to balance. Yeah.
You cannot underestimate the value, the social currency of being wounded.
That is so true.
It is huge. If I park you in at the shopping center and you come out and you're like, yeah, and I whip out my crutch and I hobble.
you were so right.
I'm so sorry. My degenerative spine. I really can't walk. You're not going to go, okay, listen,
You're right.
move along.
Yeah.
I don't care. Oh, let me just help you to your car.
Yeah.
Let me just help you with those groceries while we're about it.
Yeah.
Because we have this amazing currency. And also not just the currency of getting away with things, which is a bit of a laugh.
We become interesting. We're not
We're
boring anymore.
interesting. And we connect so quickly to somebody who has a story.
Wow,
If I come to you and I say, hi, my name is Angela, it's a whole different story if I come to you and say, hi, my name is Angela, I've got cancer.
Yeah.
We have a whole different level of connectivity, of care. And what do we all crave? We're all looking for affirmation, love, attention, and care.
Yeah.
We're all looking for that.
That's
so
very true.
You cannot underestimate the value of woundology, and it's very, very common to have pain. Once you get rid of the actual structural cause or the physiological cause of what might be causing the pain doesn't go away. Why? Because it works. For me, it's a sabotage program that works.
I think that's what's tough for some people is that to continually be positive when they're not experiencing results is a very, very difficult thing. But we'll get your tips on how they can do that, especially from you, and in terms of NLP practices and techniques and things like that. Well, as you can hear, back pain is a common yet complex condition. It can be surprisingly difficult to treat, and because surgery is considered a last resort by many practitioners, it leaves room for many alternative therapies. So we went in search of one of those treatments. Let's take a look. So I've tried foam rolling of late, and it's something that's really been helping with my recovery. I'm at Functional Training SA today, and I'm with Shay Bressler. And you know Shay, she's our biokineticist on the show as well. Shay, you actually recommended that I should start foam rolling. Tell us a little bit more about what it is.
Well, so foam rolling is the layman's term. So that's what that's what you would hear from a day-to-day person. We call it self-myofascial release. What it means though is that we're trying to get a better mobility in our body.
Okay.
So we're trying to get better mobility. The idea is that we're trying to release between the skin and the muscle, we have a layer of fascia.
Yeah.
And it is connected throughout the body. It connects everything. So if you imagine me pulling on your shirt here, you're going to feel it there. So if your fascia here is tight, it can cause something else to go wrong.
Hence referred pain. So you may feel something in your back, but it's stemming from somewhere else in your body.
Okay. Just because the symptom is somewhere, the cause might be from somewhere else.
Okay.
So the idea with the foam roller is that we're trying to loosen that fascia and create more mobility, trying to roll out trigger points, things like that. That's what we're trying to do when
Increasing
it comes to foam
circulation
rolling.
as well?
Absolutely, very good for circulation.
Okay.
Yes.
Now some foam rollers, like this one for example, sort of mimics the hand and fingers, whereas something like this is a little bit more plain. Does it actually matter?
No, you know what? I think it just depends on your goals and what you're using it for, and perhaps maybe your level of activity.
Okay.
So something like this is a little bit softer, and I think if you've just started using a foam roller,
That's a better option.
Probably a better option. It can be a little bit sore.
Would this type of a foam roller be better for elderly patients?
Absolutely, definitely. This is very nice for elderly, and foam rolling for elderly is definitely something I would encourage. So I'm glad you brought that up. This is a very nice option for them. Yes, definitely.
Should kids be foam rolling?
Absolutely. There's no one that shouldn't be foam rolling. There's lots of benefits to it. Young, old, active, not active. So it's definitely a good option for all people to be foam rolling, definitely.
Is it possible to foam roll too much?
Definitely. I think I encourage all of my patients that if you're foam rolling and focusing on your mobility a lot, remember to stabilize something at the same time. So the two go together. If you're mobilizing a joint, you must stabilize it too, because you can over-mobilize something and then it will create an instability in that joint. So yes, you can over-mobilize. Absolutely. And there's lots of tools, I mean, on the internet and stuff that you could follow and give you guidelines on foam rolling.
Okay, so that you can book a session with your biokineticist, your physio, and ask them as well, and just see what your specific foam rolling plan would be. But Shay's going to take me through some exercises now.
So we chatted about your lower back stiffness and your hip stiffness that you get quite often, and you've seen me for quite a few sessions, so we have been working on your posture quite a bit. So let's discuss some things that you can do with the foam roller for your hips. So what I want you to do is sit on the foam roller for me with your bum. Good. Hands behind you, so support your body behind you. Good. Okay, so now we're going to roll your hips out a bit. So I want you to cross your right foot onto your left knee. Okay. This is the side we're going to be rolling, so I want you to sit more onto your right bum. Good. And now I want you to roll backwards and forwards, and you'll feel that stiffness almost straight away. Okay. I would recommend you do this for about 30 seconds, and then you can swap sides. And it's sore while you're doing it, but I promise you, when you're done, you can feel the relief in your hips. Okay. Now, the next one that you can do is I want you to sit more onto the ground. Good. Now, put the foam roller onto your upper back. Good. That's perfect. Support your neck. Great stuff. Okay, now lift your bum up a little bit and just roll backwards and forwards for me. Good. Nice and slowly. So the key is here, we're trying to take away from that forward posture. So you want to open up your shoulders a little bit, so you're counteracting that posture that you would normally sit in when you're sitting behind a desk, when you're driving, when you're on your cell phone. Okay, that's the idea that we're trying to get here. And same thing, you can even do this for about a minute. Okay, sit up for me. The last one we can do is for your lower back now. Okay, so have it close to your lower back, that's perfect. Support yourself with your hands behind you. Okay, that's good. Now, you can roll there for me, so drop down a little bit, good, there we go. And what you can do as well is turn to the side a little bit, okay? Now you're on the side of your lower back. See, now we're just focusing on the one side, it's just off the spine, and then you can go and change to the other side. Same kind of time, so 30 seconds on the one side, 30 seconds on the other side, and if you're feeling one side is more stiff than the other, then you can just roll that one a bit extra. This can be done every morning, every night, depending on how you're feeling. People wake up with a stiff back in the morning, and if you do, you grab your foam roller, first thing in the morning, just roll your back out. It'll get you moving better for the day.
Well, after the break, we look at some common and some interesting ways that you can treat chronic back pain. Stay with us.
I'm feeling better.